Jennifer Smith.
I'm Melva Jones.
And we are Women's Health in Black and White. It's been a little while since we updated COVID.
Yeah.
And a really cool report came out of University of California, San Francisco and University of California, LA. And I just wanted to touch on it because it is the largest study done so far about pregnant women with COVID. Right now it has 600 participants in the study. And this is preliminary findings. By the end of the study, there'll be over 1,300 participants. They're aiming for 1,500. The average pregnant COVID patient did not have fever as the presenting symptom. In fact, the presenting symptoms, the two most common, were sore throat and cough. So if you're feeling sick, waiting for a fever before you get tested for COVID, you might have a long wait.
Right.
25% of the patients presented first with sore throat and 16% presented with cough. And something like 40-something% didn't have fever ever the whole time. The average COVID patient who was pregnant had symptoms for 3 weeks. The extreme was 8 weeks. This is not something you're going to get over in 10 days like the average cold.
Yeah.
And there were patients with symptoms as long as 5 months later. So these patients that started with COVID in February are still having symptoms. It took 37 days for the symptoms to resolve. It looks different on a pregnant woman, apparently. The study did focus on transmission from mom to baby and did not find any pre-birth transmission from mom to baby. There were some after-birth transmissions from mom to baby, but even the leaders of this study concluded that separating mom and baby is a bad idea. So that's the update. We are seeing that COVID looks different on pregnant women. We are seeing no transmission from mom to baby, and we are seeing that babies and mamas do better when you leave them together. I would still recommend wearing a mask, washing your hands. Let's prevent you spreading this disease to your infant, but take care of your baby.
Right.
Hold your baby, nurse your baby, and hang in there. COVID goes away eventually, but apparently it takes weeks and weeks and weeks and weeks
And weeks.
and weeks. So that's the update. That's all I've got right now on COVID, but if anything is released in the news, we'll talk about it as soon as we can. If you have questions about it, if I don't know the answer, I'll try to find it for you. So like on Facebook and Instagram and Twitter. Follow our podcast Afterglow on almost any platform you listen to podcasts. And if you have questions, send them to us. Be well.